Hello, I'm Alfonso Severos from Second Saturday. Right now, you are watching Health and Wellness with Rose Ann Green.
They can't keep doing the same things over and over again and expect a different result. And we have to have clear thinking, so we have to have the nerves flowing properly. So the spine is very important. So the spine needs to be corrected.
I was in a tragic accident, and the x-ray and the MRIs from that accident detected that I was in stage 3 Hodgkin's lymphoma, which is a form of blood cancer.
I always say that first because food is first, but it actually is the patient, the doctor, and the nutritionist working together as a team.
Certainly, I do recommend a holistic approach. I think generally, globally, that's where the world is heading. We have to remember who we are.
Welcome to another episode of Health and Wellness. I'm your host, Rose Ann Green. Today, we're joined by Dr. Vignesh. He's going to talk about GERD and also heartburn. Stay with us.
Don't worry. I know.
I'm doing it for me, and my insurance covers it.
I am ready.
It's time to get screened for colon cancer. It can be prevented. There's more than one way to screen for colon cancer. And screening is easier than ever. If you're 50 or older, talk with your healthcare provider and choose the best test for you. If you're uninsured, call 1-866-442-CANCER.
Hi, I'm T. Billy Martin from Women Are Talking TV, and right now you're watching Health and Wellness with Rose Ann Green.
Thank you so much for being on the program, Dr. Vignesh. Welcome back on the show. Previously, we talked about colon cancer and just bringing awareness because this month is Colon Cancer Awareness Month. But today we want to talk about a different subject, which a lot of persons, they're not sure about the seriousness of it, and that's GERD. And you're going to explain a little bit later what it is. And also, but we want to start from what is acid reflux. We want to look at that real quickly, what exactly it is.
Well, thank you again for having me, Roseanne. I think this is a very important topic that is relevant to everybody of all ages.
Right.
So acid reflux has become a very common problem. And first thing we all should know is we make about 2 liters of hydrochloric acid every day.
Wow.
And it's in the stomach. The stomach is built to handle this acid. But the food pipe, or the esophagus as we call it, is really not built to handle that kind of acid.
Wow.
So what happens is when the stomach contents, which is often a mixture of acid and food and bile, they reflux or just travel up the food pipe.
Right.
It causes symptoms, which are often in the nature of burning or pain or other symptoms. And in some people it is more severe. That the reflux can happen all the way up to the back of your throat.
Cool.
It's also important to know that to some extent reflux can be normal.
Right.
If you eat a large meal, you can have a little bit of reflux. If you eat a meal and immediately lay down or exercise, you can have reflux.
Right.
We call that physiological or functional reflux.
Okay.
So that is just reflux.
Right.
But when it gets very frequent or causes bothersome symptoms or other consequences, then you add the word disease. So it's gastroesophageal reflux disease.
Okay.
And we just call it GERD. So it's easier to say.
Because it's easier to pronounce that way.
GERD.
Right. And explain to us what is GERD.
Well, GERD, again, is gastroesophageal reflux. So the stomach contents, which, the bulk of it is acid, when they reflux up the food pipe to the point where it causes troublesome symptoms, then you call it GERD or gastroesophageal reflux disease.
Right.
Now, what is bothersome? That may vary for everybody, but generally, if it's more than twice a week, we think that is.
And that's one of the sign or symptom, correct, of it. What are other signs or symptoms of GERD?
So the common way this manifests is what people call heartburn, which is nothing to do with your heart per se.
Right.
Sometimes can be confusing, but often they describe it as a burning sensation under the breastbone, and that's what people call heartburn.
Right.
The other common symptom is sour or bitter fluid that comes up all the way to the back of your throat.
Right.
And sometimes that can trigger excessive saliva, what you call water breath.
Wow.
So these are relatively common symptoms. Other symptoms could be cough at nighttime. People wake up and cough, or early morning throat clearing, and that's from chronic or long-term effects of acid on your throat and voice box. And sometimes people can actually have asthma from the acid getting into your lungs, or just causing a reflex spasm. What that means is the acid in the food pipe triggers the nerves in the lungs to cause a asthma-like spasm.
Wow.
So those are, not very rare, but rarer than the other symptoms we talked about.
So what are those specific symptoms that would warrant me or any other person who's suffering from these symptoms that you're saying to visit my doctor, that this is time to go to the doctor and check this out?
That's a good question. And first, I would say that if anything is bothersome to you, or if you're concerned, then that warrants a visit.
Right.
And then that threshold varies for different people. And I'd rather somebody see their doctor sooner than later. But if your reflux symptoms happen more than twice a week, then that is something that you want to bring to the attention of your primary care doctor. Even if the reflux is occasional, but it's severe. So you may have it once in 2 months, but it's such severe burning that you can't sleep.
Wow.
And in that line of thinking, if it interferes with sleep or other activities during the day, so it's really affecting your quality of life, that's an indication to see your doctor. Or if there are other complications. For example, acid can cause scar tissue and interfere with your ability to swallow, or after swallowing, the food may get stuck. So those are, definitely warrant seeing your doctor. Sometimes I've had patients come with bad breath, which sometimes can be a sign of acid reflux. So if something out of the ordinary, then see your primary care doctor, and the primary care doctor may guide you, you should see the gastroenterologist, or they may refer you to the ear, nose, throat doctor.
Okay.
Okay.
Oh, wow. And let's go through some of the causes. What causes GERD?
Well, in terms of what actually happens, the cause is what prevents acid reflux. Let's talk about that. There's a muscle sphincter at the bottom part of your food pipe. And that area of muscle has high pressure, so it closes after you swallow. So in other words, when you swallow, and part of the swallowing is also the food traveling down the food pipe, when the food has gone into your stomach, the sphincter closes to prevent the acid washing up. Unfortunately, the sphincter we have there is a weak sphincter. And if that becomes lax or open, then it causes acid reflux. So the question is, what causes that? Any increase in pressure within your abdomen can cause or worsen acid reflux. Even obesity, fat within your abdomen. Pregnancy is a physiological cause of severe acid reflux because it increases the pressure in the abdomen. Rarely other tumors or other fluid accumulating in the abdomen can cause acid reflux. Several medications can weaken the sphincter and cause acid reflux. It's important to go over what medication somebody's on. Peppermint, chocolate, coffee, and some people are more sensitive than others. They all work by relaxing that sphincter. So there's a lot of different causes. Sometimes people have, the external part of the food pipe is the diaphragm, which is the muscle that separates the chest and the abdomen. That also supports that sphincter. It has two separate bands of muscle that squeeze that area. But if that becomes lax, again from obesity or other injury, then that sphincter doesn't have that support, and it can contribute to acid reflux.
Okay. For patients that come in with in terms of symptoms, how do you properly diagnose that person to say that you have GERD?
Well, a good conversation with the patient in the doctor's office, what we call a gastroenterology consultation, is more than adequate to diagnose acid reflux. It's by history and physical exam, as we call it. And most of the time, we're able to begin treatment just after that clinic consultation. And the medications are to suppress stomach acid. If somebody comes in with what we call alarm symptoms, which could be weight loss, or which could be inability to swallow, or food getting stuck, solid food, or rarely bleeding, or severe chest pain, then it might warrant other tests to confirm the diagnosis or rule out other causes. Would you like me to go over the other
in
tests?
terms of the test, though, let's talk about the test in terms of the different tests that you go through with that patient if you suspect that person has GERD.
Well, if we did want to take that route, for example, if there were other more serious or concerning symptoms, or if somebody did not respond to the the basic acid blocking medicine, then we would consider an endoscopy. So an upper endoscopy, as it is called, is where somebody first gets sleeping medicine intravenously, so you don't feel anything, and then a very skinny small tube with a light bulb and a camera is gently passed through your mouth, down your food pipe, and then we very carefully examine the lining of the food pipe. The upper endoscopy actually goes past the food pipe into the stomach and about first 6 inches of the small intestine. All of this takes about 10, at the most 20 minutes. That's the most it can take, and it's extremely well tolerated. And patients, take about another half an hour to recover from this sedative or anesthesia. And when we do the endoscopy, first part is examining the lining, but if there's something abnormal, we may do biopsies to confirm our diagnosis.
For persons who are coming in for this test, though, how do they prepare for it? Do they come in on an empty stomach, or what exactly would you recommend for them to do before to prepare themselves?
Yeah, that's exactly right. That's the only preparation necessary. You can have your normal meals and dinner the night before. We again ask patients to take their essential medication the morning off. And essential medication usually is heart medication, blood pressure, or anything for asthma or other essential medication, not supplements. And then they have to fast that morning off. So no breakfast, no coffee. And they need somebody to accompany them to either escort them home or to drive them home.
And this is because of the sedatives that you give to them, and for them to be a little bit out of it, so they need someone to drive them home, correct?
Absolutely. Yeah, I mean, some patients wonder why they need somebody because they wake up and they feel normal.
I know a lot of persons asking that question,
I think I'm glad you brought that up, because you feel wide awake and alert within 20, 30 minutes, but your reflexes are not quite back to normal. So it is a requirement that you have somebody. If you may go in a bus or a taxi, as long as you have your own escort, who's paid, who's watching you, and or somebody can drive you home.
And the best part of it is, for persons you're diagnosed with GERD, how can we treat? What's the treatment plan for this?
Well, we all first go over diet and lifestyle measures, and then I'll get into that, and then we have different medicines to block stomach acid. And the vast majority of people with GERD or reflux disease improve with this. So in terms of diet, diets that are rich in fat or fried food relax the sphincter. And that can aggravate GERD. So obesity itself can weaken the sphincter because the fat infiltrates the wall of the food pipe. So both in the short term, avoiding fatty foods, and in the long term, it can help your reflux symptoms. This has actually been studied, and weight loss alone is almost as effective as the medication. But that is usually only one part of the treatment. And some patients will have specific intolerances to certain foods, such as tomato sauces or citrus, orange juice or something like that. And we generally recommend avoiding such foods because at the least they can aggravate symptoms. They may not cause any damage, but you could alleviate symptoms. And in terms of timing, it's very important that you don't lie down flat soon after a meal, especially after dinner. We recommend.
That's very important for persons to know.
It turns out that it is because often people have bothersome reflux at night. They wake up coughing or with chest pain, and it's a simple change in your daily routine. We recommend you have 3 to 4 hours between dinner and bedtime, and no after dinner snack. And this really does the trick for most people. We talked about weight loss if you're overweight or obese, and certain medications are known to cause reflux, so that's specific depending on the person. And in terms of the acid blocking pill, many of you might have seen on TV the purple pill, or now other pills like Nexium, and they're all the same type of molecule, but with little differences, and they block the final step in stomach acid production. So when you take this medicine regularly, after a few days you don't make stomach acid, and that really makes a difference both in terms of relieving symptoms and also preventing damage from acid.
Right. Because I know for Nexium, and I usually take Nexium in terms of, doctor would say that will coat your stomach, because there are certain medications that you have to take that would really mess your stomach up. So they're saying take the Nexium, and I find that it works. It does work. I'm not so privy in terms of taking medication, but it does work. So that is very interesting. But we want to see now, in terms of, after all of that, when do I need to go and see my doctor?
Well, you know, I think some, I don't know if you're alluding to over-the-counter availability of these medications, but I would like to bring that up because the times we live in, the direct patient advertising, many patients have already taken these medicines over the counter, and then they see their doctor or the gastroenterologist. And then, you know, we go over all our steps, but then we have to make a decision. Does this person, you know, do they need long-term treatment? And you know, you go over those assessments, but let's just say that you determine the person has significant frequent reflux disease, and you need to take this medicine regularly. Then we would recommend that they take it every morning, half an hour before breakfast, long-term. And in some cases, to get a better handle on the symptoms, we might stop it and do an additional test. I'm talking about patients who already put themselves on over-the-counter medication. And if it's not clear, we stop the medicine, and then we do another test called a pH measurement. We want to measure the acid in the food pipe to see, is there really acid reflux, or is it something else? And that can be done very easily, either with a little tube through the nose, or people, if they don't like that, a little capsule that can be actually kept in your food pipe for 24 to 48 hours. And then we get a yes or no answer, and also how severe. If there's reflux, how severe is the acid exposure? We can measure that.
Finding colon cancer early gives me the best chance for treatment.
We got screened because I know colon cancer doesn't always come with symptoms.
I was worried about the cost, but got screened when I learned there are options.
My doctor helped me find the right test for me.
We got screened when we turned 50.
We're so glad we did.
If you're 50 or older, talk with your healthcare provider. There's more than one way to screen for colon cancer, and it's easier than ever. If you are 50 or older, get screened for colon cancer.
Hello, I'm Alfonso Severos from Second Saturday. Right now, you are watching Health and Wellness with Rose Ann Green.
My mother shaped me as an actor, as a musician, as a human being. So when she was diagnosed with colon cancer, it was like our entire family got cancer. And she died when she was only 56, so this is personal. And hopefully my heartbreak is your wake-up call. You can prevent colorectal cancer. If you're 50 or older, get screened. Screening saves lives.
I know a lot of persons, they may have, they have a difficulty telling, especially older folks, is this actually heartburn, or is it heart problems, or is it GERD, or is it, how can you tell the difference though?
Well, that's an excellent question. And we do have an open mind when we see these patients. And often the primary care doctor raises that question. Sometimes the primary care doctor feels this is GERD or acid reflux. And I have seen patients, you know, who don't quite fit acid reflux. And my approach is you always have a low threshold to suspect heart disease. But there are certain flavors of the pain. For example, people with heart-related pain from your heart have a chest pressure. And the pain sometimes gets worse with activity, physical activity. There can be associated breathing trouble. And, you know, we put everything together. What we learn, you know, that's, you know, we go over detailed history and symptoms. And some of it is also the risk factors. For you mentioned older patient, but say they already have diabetes or high blood pressure or smoking, which are risk factors for heart disease. Then that, you know, impacts how we make an assessment. And if in doubt, we send the patient to a cardiologist to rule out that problem.
And for persons who are on medication for GERD, though, what are those side effects?
That is an excellent question. Some patients are well aware of what's, you know, out in the media, and others aren't. But I hope this will benefit all. A lot of side effects or possible side effects have been raised over the years.
Right.
Many of them have been unproven.
Okay.
One of the important things is the acid blocking medicines, such as Prilosec and Nexium, can theoretically interfere with calcium absorption. And there was some association to fracture risk. But there's no real cause and effect relationship to bone thinning.
Okay.
That's been studied and unproven. So
Okay.
they do not cause osteoporosis or bone thinning. They do not. But it's a legitimate question. And anybody who's on these medications over a year, we recommend that they take calcium and vitamin D supplementation, and also get a bone density scan. And the primary care doctor and the gastroenterologist work together. But I wanted to bring that up. And there are some other side effects that have been raised and unproven. Sometimes after a year they can cause electrolyte disturbances, not in everybody, but we monitor that.
Right.
There's some association with infections. Again, there's no proof. The studies were done in elderly patients who would be at risk for infections even otherwise.
Right.
So it's not 100% clear if the medicine actually causes it.
Right.
But this is, I think, a perfect conversation with your gastroenterologist.
Right.
I don't think we will be able to cover every side effect,
Right.
but I think I can confidently say that the majority, or if not all, of these side effects that have been raised in the media have been unproven one by one.
Right. For your patients, because I'm sure you see patients of different age group, do you recommend or do you recommend medication based on, because older the person is, the less likely they'll like the aggressiveness to a certain medication or just the reaction to a certain medication. How do you work that out to make sure that's the best medication plan for that patient?
Well, the simple answer is when we do start somebody on a medication, any new medication, including this, we follow up with them in our clinic in a few weeks.
Right.
And we educate them about the common side effects. In this class of medications, fortunately, there are not many side effects. It's very rare.
Which is good.
But we make sure they have our numbers. We make sure they have easy access to us. And I almost always will follow up with them in 2 to 4 weeks to go over, any, intolerance.
Right.
Sometimes it's an intolerance, not a real side effect.
Right.
And then we have to make a decision. Does this warrant changing the medicine or cutting the dose, or is it something unrelated? So I think the best answer I could give you is follow up in the clinic, and if not, we have easy access to one of our doctors over the phone.
Right. For persons who have GERD, but they're, for any reason, sometimes they don't take their medication properly or they just don't take it, does it improve? What are those complications that they'll have?
Well, that's a little tricky. So one of the things we as gastroenterologists realize is the symptoms don't correlate perfectly with what damage the acid causes inside. So, of course, symptoms are important, because one aspect is improving quality of life, improving, or relieving the symptoms. But some patients can feel better after some time and still have ongoing reflux.
Right.
And it takes, experienced gastroenterologists and having a good conversation with the patient to pick up on that.
Right.
And it's recommended that patients over the age of 40 with certain risk factors and frequent reflux have at least one endoscopy.
Right.
And the reason for that is there is a risk of precancerous change to the lining after years of reflux. And often when people say I've had reflux on and off for a couple of years, it's a little more than that. So I usually ask patients, think back in time when you never had it.
Right.
And if it's over 5 years, then at least one endoscopy, not in everybody, but men are at risk just by being male, over 40. If you're a smoker, that significantly increases your risk. If you're obese. So the endoscopy, if it's normal, then that puts them in a low risk category.
Right.
But sometimes the endoscopy can show damage, such as ulcers or small ulcers called erosions.
Right.
Then we may give them a little more aggressive treatment, higher dose of the medicine.
Okay.
And sometimes, if you don't treat it, then you can get scar tissue, which narrows the food pipe.
Ooh.
So those, I would say, are the main complications, the erosions with the inflammation from acid, scar tissue, and the precancerous growth or lining change, and the the biggest risk is esophageal cancer, and we definitely want to prevent that.
Yes.
And that's one of the reasons you want to start the medication early, and if the gastroenterologist recommends an endoscopy, to have that done.
Right. For a lot of persons who they're having the symptoms and they're home just watching, they're saying, yeah, I have the symptoms, but I don't really want to go to the doctor. What would be your best advice that you give to them before we close?
Well, I would encourage them at least to have a chat with their primary care doctor.
Right.
You know, there are community events, you know, that we organize, including for reflux disease.
Right.
I would certainly encourage them to attend one of those to get more information.
Right.
But if you do have symptoms, I don't think you lose anything by having a conversation.
Right.
And whether we, you know, most patients don't, you know, undergo an endoscopy if that's the fear. But I would encourage, because the best way you can make decisions is when you're informed, when you're educated.
Yes.
So educate yourself so you make informed decisions.
Right. Wow. It's awesome to have you on the show, Dr. Vignesh, because you bring so much awareness to the topics that we discuss. And a lot of persons are suffering from heartburn and suffering from GERD, and they just want a better understanding of how to manage this disease and how to go about easing themselves into the treatments and stuff like that, and to be comfortable. And this is very important to our viewers, to be comfortable with their primary care doctor, and also to be comfortable with someone like you who know what you're doing and bringing information to them and informing them as you treat them. So thank you so much.
Thank you so much for this opportunity.
It's been my pleasure. Yes, it's been my pleasure. And thank you so much to our viewers for staying with us and watching and learning and being informed. Thank you so much for joining us. Stay well.
Imagine a world with more birthdays. Imagine a world where cancer is scarce. Getting tested for colon cancer can help you celebrate more birthdays with those who matter most. Imagine how happy your family will be to have you with them year after year. Picture yourself spending more time with your friends and family. Call your doctor and make an appointment today. Anyone can get colon cancer, both men and women. If you have a colon, you're at risk. If you're 50 or older, talk to your doctor about colon cancer. Your friends and family will be glad you did. We're the American Cancer Society, the official sponsor of birthdays.